Hey guys, this is Dr. Hub. Today we look at the clinical classification of the spontaneous abortion. So first we'll look at the threatened. So in terms of threatened, there is a bloody vaginal discharge or bleeding. So it is bloody vaginal discharge or there is bleeding. Next is there is a closed cervical loss. There is presence of closed cervical loss, and when you look at the USG or the investigations, here there is a presence of the gestational sac or the pseudo gestational sac. So there is gestational sac or the pseudo gestational sac is present, and when you look at there is a fetal cardiac activity is present. Next we look at the inevitable. So inevitable, there is a gush of vaginal fluid or bleeding. There is gush of the vaginal fluid or the vaginal bleeding. Next is there is cramping or fever. There is cramping or fever. Then comes the presence of the dilated cervical loss. There is dilated cervical loss, and there is also the gross rupture of membrane. There is gross rupture, and this is the membrane. So what are the USG and the investigation findings? So USG and investigation findings, it is a low-lying sac. It is low-lying, as well as there is oligohydramnios. Next we look at the incomplete. So under incomplete, there is presence of vaginal bleeding, and there is partial or complete separation of the placenta. There is partial or the complete placental separation. Next is there is presence of the dilated cervical loss. There is dilated cervical loss, and here what is the USG and investigation presentation? So there is retained products of conception are seen. Retained products of conception. So retained products of the conception, they are seen. Next we move on to the complete type. So in terms of complete type, there is the heavy vaginal bleeding. So it is heavy. There is heavy vaginal bleeding, and this vaginal bleeding is associated with cramps. So this heavy vaginal bleeding, there is also presence of the cramps. Then there is a complete placental separation. There is complete placental separation. So there is complete placental separation, and this is with the passage of tissue or fetus. So there is passage of tissue or the fetus. Next is the presence of closed cervical loss. There is presence of closed cervical loss. So what are the USG findings here? And investigations is minimally thickened endometrium. So it is minimally thickened endometrium. And other important thing is that the gestational sac. The gestational sac is absent. It is not present. Next we move on to the missed or early pregnancy. Missed or the EP, that is a early pregnancy failure. Early pregnancy failure or the loss. So what are the findings here? So they have presence of the dead products of conceptions. So dead products of the conception, and that we retained for days, weeks or months in the uterus. And there is a closed cervical os, presence of the closed cervical os. So what are the USG and the investigations? There is a large anechoic sac. There is presence of the large anechoic sac, and this is nothing but consistent with an embryonic gestation. So it is consistent, and this is with an embryonic gestation. Then there is also the serial beta HCG assay. Serial beta HCG assay. Now let's look at the septic. So in terms of septic, there is a pelvic infection and the sepsis syndrome. There is pelvic infection as well as the sepsis syndrome. Sepsis syndrome. It is seen in about 1 to 2% of the women. So it is seen in 1 to 2%, and this is of the women, and this is with a threatened or incomplete miscarriage. With a threatened or incomplete miscarriage.